evening. It's Wednesday, March 17, 2021 here in Cebu City. I'm Cherry Ann Lim and this is SunStar Tonight. The Department of Health in Central Visayas will pull out the allocated second doses of the AstraZeneca COVID-19 vaccines from hospitals in the region. This is so the vaccines can be redistributed to the COVID-19 temporary treatment and monitoring facilities and emergency operations centers. Shari Coronel reports.
The Department of Health Central Visayas said it will pull out the allocated second dose of AstraZeneca COVID-19 vaccines from hospitals in the region, which started administering this and will be given to temporary treatment and monitoring facilities, emergency operation centers, among others, so this can be utilized before it expires on May 31, 2021. DOH Regional Spokesperson Dr. Mary Jean Loreche said the pullout has nothing to do with the issue on AstraZeneca's efficacy. Loreche, though, assured that the second dose for those who are already given the first dose of the AstraZeneca will be in the region in time for the second dose. She said the ideal time for the second dose ranges from 6 to 12 weeks since the first dose, but she recommends to administer it to the vaccinees on the 12th week after the inoculation for the first dose. The DOH spokesperson said by this time the immunity can already kick in and will give the body enough time to recharge. She also said they are not pulling out the Sinovac vaccine as its expiration date is on January 31, 2024 yet. As to the issue with AstraZeneca vaccine, she said the World Health Organization, the Centers for Disease Control and Prevention, and the European Medical Association stand by the result of their studies and clinical trials that the AstraZeneca is very safe and effective vaccine. As of March 15, the region has already been allocated over 100,000 doses of Sinovac and AstraZeneca. From the Sinovac vaccine, she said a total of 13,835 doses have already been given to the healthcare workers in the region, while a total of 2,433 doses of AstraZeneca vaccines have already been given to healthcare workers in the region. Chari Coronel, SunStar Tonight.
Foreigners and returning overseas Filipinos who are not contract workers have been temporarily banned from entering the Philippines starting March 20. Kenneth Torres reports.
The National Task Force Against COVID-19 will temporarily prohibit inbound travel of foreigners and returning overseas Filipinos who are not contract workers to prevent a further rise in cases with COVID-19 variants. The restriction will take effect at 12 a.m. of March 20 and last until 11:59 p.m. of April 19, 2021. In a memorandum circular issued yesterday, NTF Chairperson Delphine Lorenzana also set a limit to the number of international arrivals to 1,500 a day. A Civil Aeronautics Board advisory said this will be implemented from 12 a.m. of March 18 to 11:59 p.m. of April 18, 2021 at the Ninoy Aquino International Airport. However, holders of visas, medical repatriation and their escorts, distressed returning overseas Filipinos, and emergency humanitarian and other analogous cases approved by the NTF are still allowed to enter the country. Lorenzana's memorandum noted that the entry of COVID-19 variants with possible increased transmissibility is among the factors that led to a surge of cases in the country. The Department of Health and UP Philippine Genome Center announced on March 13 that additional cases with variants have been detected. There were 59 new cases with a UK variant, 32 new cases with a South African variant, and 1 case with a P.1 or Brazil variant. Of the 59 UK variant cases, 18 are returning overseas Filipinos, 30 are local and 11 under verification, whether they are local or returning overseas Filipinos. The first reported UK variant case in the Philippines is a returning Filipino from Dubai. Among the 32 additional South African variant cases, 1 is a returning overseas Filipinos, 21 are local and 10 are under verification. The sole Brazil variant case is a returning overseas Filipinos with address in Western Visayas. As of March 13, there were 177 cases with a UK variant, 90 cases with a South African variant, and 1 Brazil variant. The PGC had also announced a total of 98 cases with mutations that were assigned to a new P.3 variant, which was detected first in Central Visayas. Kenneth Torres, SunStar Tonight.
Today's groundbreaking ceremony for the carbon market redevelopment was postponed due to some concerns by vendors regarding the project. Meanwhile, a traffic rerouting scheme will be implemented near the carbon market in preparation for the Holy Week. Chari Coronel reports.
Today is supposed to be the groundbreaking ceremony for the modernization project of Carbon Public Market in Cebu City. However, the Cebu City government has postponed it due to some concerns raised by the vendors which still need to be addressed. Cebu City Market Administrator Ervin Cabali said Mayor Edgardo Labella does not want to push through with the groundbreaking while some vendors are still protesting with the redevelopment project. Cabali said one concern raised by the vendors is the system of collection of the rent. The vendors want that the collection will still be done by the city government. However, based on the joint venture agreement, the collection will be undertaken by the Megawide Construction Corporation. Cebu Market Vendors Multipurpose Cooperative Chairman Erwin Gokong Sr. said other condition they asked, which the Megawide is yet to answer, is they want the Warwick Barracks and Freedom Park to be still managed by the city. Cabali said once the issues will be settled, the groundbreaking ceremony may push through next week. Meanwhile, there will be a traffic rerouting scheme to be implemented in Carbon Public Market starting Monday, March 22, in preparation for the Holy Week. Cebu City Police Office Director Colonel Josefino Ligan said under the rerouting scheme, private vehicles and motorcycles cannot enter the market. Allowed to enter will be vehicles carrying supply to be sold at the market and delivery trucks, but only at Warwick Barracks. Vehicles will now enter Iscanio Street, corner Magallanes Street, and exit at MC Briones Street, going to the Senior Citizens Park. For shoppers, entrance and exit will be at Iscario Street, Manalili Street, and MC Briones Street. The streets of Kawit, El Filibusterismo, Calderon, Plaridel, and F. Gonzales will be closed to traffic. Chari Coronel, SunStar Tonight.
A year into the coronavirus pandemic, people have been experiencing chronic exhaustion known as burnout. The World Health Organization has described burnout as a syndrome. Here to tell us about the stages of burnout is Tiffany Neri.
We hear people talk, tweet, and rant about being burned out all the time. It is honestly a common and very concerning phenomenon. So how do you know that you're experiencing it yourself? Well, here are the 4 stages of burnout. Stage 1. Physical, mental, and emotional exhaustion. One day you could be happily doing your tasks one after the other, then finding yourself stuck on what to do the next. You start dozing off at 2 p.m. or zoning out in bathroom breaks. Hopefully you're just tired. But that prolonged state of exhaustion is only the beginning of one of the worst mental and emotional cycles. Stage 2. Shame and doubt. At this point, you haven't been performing up to standard because of how tired you are. You start to realize this with a kind of awareness where you criticize yourself for every single thing you do. It starts small, like the kind of shame from being late for a deadline. But then your boss starts to notice. Here's where the doubt kicks in. You start to doubt whether or not you deserve the job or anything else you've gotten in life, even your own existence. Stage 3. Defensiveness, cynicism, and callousness. You start to get defensive. It's a natural response, like survival of the fittest. You try to defend yourself by blaming other things. Then comes the cynicism. You aren't paid enough. People don't appreciate you enough. Then you just stop caring. Your boss points out that you could have done a better job. Meh, doesn't matter to you anymore. Stage 4. Failure, helplessness, and crisis. Eventually, you start to think about how everything didn't turn out as you planned. Work isn't great. You feel like a failure. You're helplessly trapped. That's when the panic starts. That sense of crisis, like you're in a glass case that keeps getting smaller and smaller. You can't move. You can't breathe. All you can think about is that there's nothing you can do to help it. To summarize it all, the 4 stages of burnout are physical, mental, and emotional exhaustion, shame and doubt, defensiveness, criticism, and callousness, and failure, helplessness, and crisis. All of these 4 things put together into a single concept? Well, that's burnout, and it's caused by prolonged and excessive stress. There are also layers to it. Your job, your relationships, even your own personality. Lucky for you, though, there are things you can do to help. So, how do we stop burnout from happening? Well, we'll talk about that next time. This is Tiffany Neri for Lifestyle on SunStar Tonight.
To get the latest, visit www.sunstar.com.ph. Follow us on our YouTube channel and official social media accounts on Twitter and Facebook. I'm Cherry Ann Lim, and this has been SunStar Tonight. See you again tomorrow. Good night.